really excited about the momentum we have and the early, data and outcomes improvements in this particular segment, and just super excited to scale it. Medicare has a lot of billing codes, right, that are created to help this population age in place, right? Well, not every code is appropriate for every, single patient that we work with, but we're trying to, figure out what will somebody benefit from and really make sure that they're getting that. Our clinical model is largely in person today because we know we're dealing with a population that would be really hard to reach virtually. And we know that we can't rely on the senior living staff to facilitate virtual visits because they're already overworked and spread.
Hello, everybody. Really thrilled to have a chance to speak to Steve Weissblum, who is the CEO of Troupe Health. And so, Steve, welcome. And if you want to just start off, tell me a little bit about yourself.
So been an entrepreneur, been in healthcare all of my career, not necessarily by choice, just sort of how it turned out. Earlier in my career, I started non-emergency medical transport business, grew into an ambulance medical transport company doing both non-emergency and emergency transports with health systems, with SNP. Started a telehealth company earlier in my career, a little bit too early in the space before there were reimbursement codes for telehealth. More recently, I was chief revenue officer of a really great company called UCM Digital Health in upstate New York. That was a kind of the convergence of my background. It was a ER, virtual urgent care, ER avoidance, digital solutions selling to employers and payers. But we had a mobile integrated health side of the business where they'd partner with local EMS agencies and send them into deploy them into the home to be the eyes, ears, and hands of our virtual docs for, on the front end, ER avoidance, on the back end, post-discharge readmission reduction program. So, I'm an entrepreneur at heart. I'm always, looking, mind's always spinning with new ideas, and healthcare is obviously incredibly challenging. And I was looking to start something new and specifically focused on bridging that gap between virtual care and brick and mortar care, and bringing care into the home the right way. One of the things I learned having worked with UCM and a few other virtual care companies is that engagement is really challenging, right? Driving utilization. If you sign a deal with a payer or health plan and that digital solution is available to the members, it doesn't necessarily going to mean that the floodgates open and they come running to use it. So it's really challenging to reach that end user and to make sure that they're comfortable with it. And while I'm a huge, supporter of virtual care, both from a convenience and unit economic perspective, especially at scale, it's not appropriate for every patient, every use case. And I was, looking at opportunities that kind of filled that gap. And in-home care, though, is really, really hard to scale because you have the same challenge you have in the medical transport business, where it's the windshield time. You're only paid when you're loaded with a patient, right? Within home care, you're only paid when you're there treating a patient. And if it's an hour drive to the next home, then, it sort of obviously dramatically cuts into the number of patients you could treat in a day. And unit economics become, a real obstacle to building a sustainable business. And I was a very big fan of Redesign Health, through a venture firm, kind of a hybrid, but really, really innovative group of people that are doing incredible things in healthcare. And their mission was to redesign healthcare. And they had started, at this point, I think they funded over 60 companies. But I was, I had some friends on the leadership team, recruiters, other CEOs, and so I was pretty familiar with the organization and had chatted about a few opportunities that didn't feel necessarily like the right fit for me specifically. Although I did love the idea of, being an entrepreneur and starting a company is really hard, and it's really lonely, and it's not nearly as glamorous as most people think. So I love the idea of partnering with such a, incredible mission-driven organization with resources, with capital, and with all sorts of other support and experience. And then the idea of Troupe came along, and it was, the concept that they funded was clinical wraparound services for senior living communities and a care coordination and communication platform that connected the communities and their staff, residents and families, and caregivers, and then external providers, creating a source of truth in the communities that didn't exist. And, when I was in the healthcare services businesses, I had a ton of experience selling into health systems and SNFs, and I was familiar with senior living, but we were more senior living adjacent, right? We were, our bread and butter was the long-term care and SNFs, and where there was more of those, higher acuity patients with more clinical needs and would need to go to the hospital more frequently. The more I kind of rolled up my sleeves and started to learn about senior living, it was pretty fascinating. The industry as a whole is very much a real estate and hospitality industry. And, a lot of the senior living properties, the majority are probably owned it by REITs or, private equity firms. They make their money off of rent. And I think the people moving in think they're moving into healthcare facilities. And there's a really big gap in both care and expectations, especially, in the last, say 5 years or so. people are waiting longer to leave their homes than ever before, plus inflation and cost, right? So when people are arriving and they make the transition to these communities, they're showing up much worse off than ever before. I mean, the acuity profile of somebody moving into a senior living community today is probably similar to that of a SNF maybe 5 or 10 years ago. But the communities themselves haven't evolved to meet this growing need, and they lack the clinical support that residents need. And when when somebody moves to a community, they have less access to their providers than they had before. So what's happening is people are aging out faster, right? And they're transitioning to long-term care, or passing away sooner than before. It's led to a reduction in the average length of stay by, I think, about 3 months, which is really devastating to an industry whose primary source of revenue is rent. So I jumped in. I was fortunate that Redesign gave me the opportunity to build Troupe, and started in I guess August of 2023. So we've been at this about a year and a half at this point, and built an incredible team of both the leadership team, really amazing, head of clinical operations, head of product, incredible chief medical officer, and then really amazing. We've been super fortunate, amazing clinical staff in the field. We have licensed clinical social workers, we have care navigators that are actually going into the communities we're partnering with, and we have nearly 100% engagement. All of our clients love us. We've really figured out like the product market fit, and now we've also figured out exactly what the opportunity is from a tech perspective. We learned that by the nature of the codes we're billing, a lot of Medicare food care coordination codes, we learned that we immediately took a major burden off of the staff at the senior living communities when we entered a building. There's typically a health and wellness director at most communities, and while the title might vary, there's somebody on site that's responsible for all the care coordination needs of every single resident. And they are overworked, they're underpaid, and they have requests piling up on their desk throughout the day. There's a lot of really incredible point solutions being sold to senior living: fall detection, sensors, pharmacogenetic labs that integrate with their EHR, connected toilet seats, and just a host of other really great solutions. And I think senior living operators they're super excited about these things. And if they, if they have the budget for it, they still have two concerns, right? One is, okay, well, what happens to all that data? It's just one more alert notification going to my already very, very busy staff. And then two is now liability. If they didn't respond in real time and there was proof that something was brewing, maybe they'd be liable for something or could be sued. So we're building an AI-enabled wellness director platform we built that not only streamlines all the care coordination and consolidates at scale all the residents' needs in one centralized location, but we're also plugging in all these point solutions and layering on AI to really connect, all the dots here. I think, to me, AI is the ultimate search engine, but it's only as good as the data it has access to. So we're connecting all those cables underneath, whether it be from the primary care notes or our clinical notes for managing the care plan, lab results, sensor data, heart rate, and all that, and giving us a really holistic, on-demand view of every resident's condition at any time that a family member could ask or a staff member. So it's kind of our mission is ultimately, though, to help people truly age in place, right? Create a situation and give the infrastructure, both technology and clinical support, where we create an environment where not only could residents stay where they are for the remainder of their lives and thrive, but also, and ultimately, we're bigger pictures, right? We're building a value-based care, AI-powered command center for senior living. Just layering in that technology and clinical services infrastructure in the building at scale that every resident could benefit from. So when we transition to value-based care, the senior living operators are very well positioned to play their role and support the residents, and kind of just making sure that there's no gaps.
Yeah, I'll tell you what, Steve, it's fascinating to hear all the background on older adult care, because I think that, and I'll mention why it was that I was really taken by the opportunity to work with you and get to know you, was that I was experiencing through my own family some challenges with my father and my mother, my sister was their caretaker, or is their caretaker, and it's challenging to do that at home. And it can go from moment to moment. It can be, my sister she has to almost get a sitter to be present if she has to leave the house, because sometimes we don't have that, let's say, technology in place to be able to help us. And so you've said a lot of information that is very deep and it's obvious that you know the space very well. I'm more curious if it's okay to ask, it's like, what do you see happening out there? Like, tell me more about what's the real need here? I'm in healthcare delivery, that I work with patients who can come to the clinic, and that's who we work with. So can you give me just some insight on what's out there? Like what are we seeing, or what should we be concerned or think about?
Yeah, no, I look, I always love our conversations. I mean, you are probably the most knowledgeable person I know, that I'm considered a close friend at this point, and just in my professional network that, really deeply understands value-based care and the right way to do healthcare. And so I always love these conversations, and I learn something every time we connect. From a similar to, I know we've chatted regularly about our own personal situations with our family and our aging parents. As you know, I'm going through something with my father right now, and he's been in and out of the hospitals for the last year. And my mother had a heart transplant in about 5 years ago in New York City at a premier hospital, and it was an incredible story. She was 72 years old. She's doing great, outstanding care. But after that procedure, when she was finally strong enough to get home, they sent her home. She was bubble wrapped with a care coordination, team that was really there to make sure that nothing slipped through the cracks. And they kept everything. They caught everything that could have, led to a hospitalization or a rejection or anything in between in real time. And, and she's thriving as a result. And my father had surgery earlier this year, about this time last year in a hospital, not in New York City. And ever since, it's, he was 82 at the time, it's in and out of the hospital, in and out of subacutes. And 1 week he was discharged from a subacute before he felt he was ready. And the subacute, the administrator came into the room and said, look, I tried. My parents have a really great, MA plan. My mom's a retired teacher, so she's got amazing benefits for life. And they're very fortunate. She worked hard for them. But, even then, the administrator came in and said, I'm sorry, your MA plan cut you off. They said, you're ready to go home. My dad knew he wasn't ready. My mom knew they weren't ready, but they didn't have a choice. So that week they went to 4 specialists, all 4 drew blood. By Saturday, he was back in the hospital with the UTI that nobody ever picked up on. And it's just a complete breakdown or lack of care coordination. And he said to me that I should have gone to that hospital in New York City. I shouldn't have gone to the one I went to. I would have gotten much better care. And I said, that's not the issue. I said, you got really great care at the hospital you were at. The problem is that my mom had this care coordination team around her, and the average person doesn't have anything remotely close to that. So how do we give people that? And I'll tell you a personal story from as recent as yesterday. My father's in the hospital right now, and he's been declining. And every single time he's readmitted, he's weaker and there's less likely of a chance he's gonna recover from it and rebound and get stronger. I think we're at that point, unfortunately. And I had to proactively call the social worker yesterday and ask that the palliative care team come in and talk to my parents, because the plan, the status quo is, let's get him out of the hospital, let's get him to a rehab facility. And now I'm thinking, well, if he's only gone a short period of time, and we don't know, and hopefully he's got years, and I hope he can rebound and get stronger. But if he can't, do we want to spend those remaining weeks in a dreary, gloomy subacute rehab, or do we want him home with his family and friends? And what's really frustrating to me, especially given when we're not operating, my parents are in the Northeast, so we're operating in Florida right now. But what's really frustrating is that nobody's even asking these questions proactively. And the social worker was amazing. When we finally connected, she was amazing. She was a wealth of information. She couldn't have been more eager to help. But I had to call and ask, hey, what are the options for my parents? Because I think they're just thinking their only option is this rehab facility. And maybe we should have a conversation about what are their goals? Like, what are they looking for? And she immediately put a plan in motion, and palliative care team should be meeting with them today. And, hopefully I'll be able to, be there when they have that conversation. But it's just frustrating, right? There's a lot of great services and resources that people don't know about. And unless you have somebody in the family or in your inner circle that's as knowledgeable as I am or you are about these things, then it's just scary. And at the end of the day, it's like these little things turn into such big things that, first of all, when anyone's hospitalized, right, it takes a toll on them, it takes a toll on the family. There's obviously the total cost of care. It's just, there's so many things that could be caught earlier that would just give people a better quality of life and lower cost. And, at Troupe, ultimately, even though we're starting in senior living, we're hoping to figure out a way to do that, right? Whether it's home care or, virtual care, is how do we kind of connect all those cables and then leverage AI and LLMs to really make sure we're catching everything in real time.
Yeah, and that's the part where I could see, because of my experience with my family, just the need. It's such a need. And I'll tell you something else that caught my attention when you first were talking to me about this, about Troupe, was I didn't know, and I've been on the clinical side, but I didn't know that some of these housing or senior living, that they weren't healthcare systems. Although, from my understanding, I think they call themselves healthcare systems, which really confused me in the beginning. But they're really more, yeah, I don't know how to describe it, but they're not health systems. They're just not. And like you said, they make money off of rent. And so instantly, my brain is saying, well, how do you ensure that the person living in these places gets the care that they need appropriately, so as to prevent just a consistent, let's say, I would imagine it's probably ER use is my guess.
Mhm.
And I think that's something that is wide open, at least as I see it. What do you think?
Yeah, I completely agree. I mean, look, to be fair to the industry, right? They are a real estate and hospitality industry, and it's not that they don't necessarily want to provide more healthcare support. It's just a matter of like resources, right? Like if they have rent, they have staff, they have furniture, they have food. It is a huge expense in these communities.
Hmm.
So it's certainly not a desire to provide more services, and there are really a lot of exceptional senior living operators out there that are way ahead of the curve and super innovative, and some of the bigger ones even have their own innovation team and department because they know this is an unmet need, and there's gaps and challenges, and there's a lot of companies like mine not necessarily doing the same thing, but just a lot of people that are doing really great stuff to try and bring these turnkey solutions to these senior living operators in a way that they could integrate without disrupting their staff, their workflows, and without increasing their expenses and just creating more confusion and disconnect within the communities. We're partnered with Innovation Senior Livings and Pilar Carvajal, who's an incredible entrepreneur and senior living operator in growing her business rapidly. And what she's excited, she's become an advisor to Troupe and a good friend, and she's just so innovative and so passionate about solving these problems and not treating this like a real estate business, but actually creating it as a home where people can truly age in place. And
Love
we're
that.
piloting some sensor and other really cool solutions that would really bring a lot of very much needed solutions and give us a lot of data in a way that didn't exist before. And specifically, she operates in the middle market, which is the lower income sort of segment of senior living, where people have much fewer resources, right? Much less, access to providers, and so we're really excited about the momentum we have and the early, data and outcomes improvements in this particular segment, and just super excited to scale it. But at the end of the day, I think that there's Medicare has a lot of billing codes, right, that are created to help this population age in place, and we're leveraging a lot of those codes so we can get to market quickly, and we're bundling them together in our Troupe Health Age in Place program. And everyone has a customized program, right? Well, not every code is appropriate for every single patient that we work with, but we're trying to figure out what will somebody benefit from, and really make sure that they're getting that. And I think that ultimately, right, when we all as an industry meaning, call it senior living and the healthcare technology and services companies that service them, really kind of crack the code on deploying value-based care in the right way, then things will change very dramatically. Because I think the strategy to be successful is to incentivize the senior living operator, let them get compensated from some of that shared savings for the role that they play in keeping their residents healthy. And that would give them more resources, more revenue to spread out, across their individual communities and their portfolio, to bring in more solutions to really continue to maximize that savings and keep people in there. And ultimately, that's what I meant when I'm saying we're building that value-based care command center. We want to build that kind of that infrastructure, right, that they can deploy. I hope we figure out a way where we get to a world where we are attributing a senior living building or even an entire operator's portfolio to an ACO or a value-based care or at-risk contract, rather than today, which I think is, and you're a lot more knowledgeable of this than I am, but like the provider, the status quo is right going to the providers. And there's a highly fragmented provider mix, a highly fragmented payer mix in these communities. So it's challenging for a senior living operator or an owner or an executive director of a specific community to put workflows and protocols in place that would impact every resident when they might only be getting paid for 5. right? Or 6 or 7 or 8 of those residents. So we a lot to figure out. There's a lot of, it's just an exciting time, right? I think in senior living, the industry got, really hit hard by COVID and by high interest rates. And a lot of the anticipated growth was put on hold. But now we're at the point where the latest data I've heard is that, the need is projected to double in the next 5 years, the number of beds. Supply demand curve is going to shift late 2027, early 2028, where they'll go from vacancies and empty rooms and empty beds to full capacity waiting list, which will then lead to price increases and so on. So I think that, in my personal opinion, senior living is one of the greatest investment opportunities in the next 5 years, and maybe not quite as exciting as AI, and definitely not as sexy, so you don't hear about it. But I know a lot of investors, specifically like private equity firms and REITs, that are really all in on this industry. And I think that's going to trickle down to the tech and the service providers, and figure out a way to leverage technology to address the growing acuity needs, to address the workforce, shortages and access to care, and keep those channels open and the data flowing.
You're very insightful, Steve. And when I think about, and I hear you speak about these, I have these pegs, so to speak, in my brain, where I always know the first principle of value-based care is change management. So to hear you talk about how to actually appropriately incentivize the right folks who are providing the care, and what change is going to be necessary to do that, is a big deal. And then the other one is always going to be data, which that Troupe is fundamentally grounded in that. And the third is population health, which is
right.
This group of folks, these group of older adults that you mentioned, Pilar, and we'll have her on next to talk to her about what she's doing. But it's this idea that when I think about value-based care from a large system standpoint, how do you continue to decrease total cost of care on this population? And when you share the statistics with me, you've done it before, it's always just alarming, frankly. It's alarming, because how are we going to manage that population and do it well? In my opinion, frankly, it's with, how do you do it with dignity, right? It's like, these folks, I hope I live a long life, but when it gets to that place, I want to have dignity when it's near the end for me, or when I'm lived a full life. I want to be able to say, hey, my family members can say and be comfortable with how I chose to leave, right? And all those things really matter to me. And so that's what I'll tell you what, it's something that, to hear you talk about Troupe and to hear you talk about what that experience can do for folks and those opportunities is, and I remember sharing this with, there was a person who I met in private equity, where I said, and I view this, and I view all value-based care, but really as a double bottom line, where you, by improving the quality of care for people, you can make a good return for yourself.
Yeah.
Go ahead.
No, you touched on something that's like kind of the critical, part of critical obstacle here, right? Which is the behavior change. And in I think post-acute in general, right? There's I don't know if it's spoken or unspoken, but when in doubt, send them out, right? If somebody falls, if somebody seems like they're not okay, let's err on the side of caution and call 911 or call your ambulance provider and send them to the emergency room. And that's devastating for the patient, right? The resident, if they can avoid it. It's a nightmare for the family. The community potentially loses a resident that they'll never get back. And there's customer acquisition cost and high cost involved with filling every bed. And not a lot of those transports to the ER are necessary, or not all of them, certainly, right? So, but how do you change that behavior of when in doubt, send them out? When I was in the ambulance business, I didn't want them changing our behavior, because those were the best transports we could hope for, right? And our SNF partners relied on us to be there and respond in minutes. But here it's about reversing that trend and keeping people in place. And look, if somebody's limited staff on the overnight shift and somebody is vomiting or was found on the floor, and of course they're going to pick up the phone and just call 911. They're not going to engage any other product or service, and unless we make it easier, right? Unless we make it easier to engage Troupe or Dr. Garcia or somebody else, right? That's going to help respond and maybe triage the situation in real time and avoid, and just put a line of defense between that kind of when in doubt, send them out. And that's what we're hyper focused, right? From a technology perspective is, I won't name names or a product, but we were talking with one of our senior living partners was vetting a solution. It was a connected solution that gave incredible data, and they were super proud, and they should be. They built like a really great product. But the operator said, well, okay, well, what happens with all this great data you're collecting from these tools? And they said, oh, well, we send a consolidated PDF to your, health and wellness director at the end of each day. And I'm just picturing this health and wellness director like looking at this PDF and saying, you got 100 people's, bathroom habits or whatever it is for the day, right? Or bathroom patterns. It's like, okay. And that gets pushed aside, right? So there's that critical missing piece of, embedding that real-time clinical response. And today it might be our clinical staff, tomorrow AI, right? But that's ultimately what we're trying to plug in is so we're kind of consolidating all that and catching things in real time. And, the point of me bringing up that point solution is they're not going that last mile and really putting themselves in the shoes of their end user, right? And that's what we're hyper focused on. That's like one of the first questions we ask at Troupe when we're thinking about building any resources or technology is this going to make their lives easier, or is this going to be just another step? Because we know if we put one more piece of paper on that stack, it is never going to be looked at, right? So how are we taking away, from that burden and decreasing it rather than adding to it? So we're hyper focused on our user experience and like a single sign-on and whatever else we could do, because having sold digital health solutions to employers and payers and been involved with a lot of companies, whether as an advisor or mentor, it's really that at the end of the day, what makes or breaks a company in a lot of ways, other than running out of money, is driving utilization, is engaging the end user and getting them to actually use that solution. So it's incredibly challenging, which is why our clinical model is largely in person today, because we know we're dealing with a population that would be really hard to reach virtually. And we know that we can't rely on the senior living staff to facilitate virtual visits because they're already overworked and spread thin. Yeah. So we are on site, going into the rooms, and like I said, we have nearly 100% engagement. But what it allows us to do, which is super exciting, is we could provide in-home care at scale. Right. We eliminate that windshield time problem I talked about earlier of in-home care, where we could go, rather than having to drive from house to house to treat every resident, we simply go room to room. And that is really a game changer from a unit economics perspective and a sustainability, and margin. Like could we have a business that could, we're a venture-backed company, but we don't necessarily always have to be, right? We could get to a cash flow positive position, relatively soon, and then grow organically from there. And that's an option we have, like a path we could go down in senior living because of the dynamics and the almost captive audience, right, of residents and patients that we want to work with that we wouldn't have in a home setting.
Yeah, I'll tell you what, that's part of. I wanted us to have a conversation because I really enjoy what Troupe is doing. I believe in Troupe, and I want you to share that story. So are there anything else that you want to share that we can use? Anything else?
Just that, it's look, anyone, you even initiating these conversations, right, is asking, is being innovative and asking the questions. I think people need to just start asking the right questions and just pay attention to the answers, right? And with Troupe, we didn't, we were fortunate to have funding from Redesign, and we had a plan and a model and a budget for our tech platform, and I made a decision. I've bootstrapped companies. I'm scrappy as an entrepreneur, and so I'm not spending money unless I have to and unless I'm ready to. And I made a decision early on. Let's not build anything yet. Let's learn. Let's go in these communities. We're fortunate that we established a medical practice, right? We could build codes under our kin and really learn what it is that the gaps are and what we need. And we wouldn't have built the right thing if we built it first. There's just no way we could have, right? And we would have burned through hundreds of thousands of dollars of our, limited capital. And we kind of took a breath and launched our clinical services as a way to get to market quickly and efficiently from a capital perspective, and really to deeply get product market fit and learn from a tech perspective, how are we going to help these communities and their residents really thrive, right? And our technology is doing two things. It's helping the communities, right, scale care coordination and touch, give them more of the right touch points to residents that aren't there. And two, it's helping our clinical team operate as efficiently as possible, because today we're billing time-based codes, right? We're logging X minutes for X code, but we're preparing for a world where we're at risk or in value-based care where we're not paid on minutes, we're paid on outcomes. So we're leveraging technology and building that foundation so we're ready for it, and we're operating, our workflows and are super efficient. And I think that, I get hit up on LinkedIn a lot from aspiring entrepreneurs that just want to get advice. And like, that's what I always share, right? Is just learn, just listen, just shut up and listen to people and don't build anything, because similar to that example of the point solution, sending that PDF, it's like, if you actually went into the community and sat down with that wellness director and looked at the stack on their desk and then visualize your PDF getting put on top of that, printed out and put on top of it, you realize very quickly that you missed something, you built the wrong thing. So I think that and I will say, there's Pilar we mentioned, and there's a lot of really, really innovative people in senior living that are really at the table and having these conversations and are eager to be a part of it, because without their input, we're never going to build the right things.
Yeah, I think I'll tell you what, I admire the fact that you've got a strategy that makes sense for your company is a lot to be said. Knowing that the first goal for yourself was to go in and learn is the differentiator. And I'll tell you, that's a huge thing, because if you understand what the person's going through from that user standpoint, it's, to your point, you would know what to build later, because you can't come up with the solution first. It just doesn't work that way.
Yeah.
And I've been in this healthcare delivery for many years, and those are the things that drive us insane is don't come to me with a solution when you've never been in it.
Right.
Don't do that, because I'm not going to buy it.
Right.
I can't. Literally, I just can't. So when someone takes the time to deeply understand the problem, that's when you get a connection with folks. And I think that's really something to admire, because that's a benefit of having experience and not only just in work, but also in life, and also with the work you've done with redesign. So I think it's awesome. I love to hear when you talk about this, because I learn a ton about the space that, I only know value-based care and healthcare delivery, but this is a unique space that's really at the edge and at the forefront of beginning the journey. So I think that's exciting. Anything else you want to share?
No, just to everybody, to all of us that are trying to change things in a positive way. Like it's really hard. It's very lonely at times, but we're all in it together. And I talk to competitors all the time that I'm happy to talk to, right? Because we are learning from each other, we're supporting each other, and frankly, this opportunity is big enough for all of us to thrive and succeed. And I just hope that there's more transparency and more, open source technology and flow of data and conversations that happen like these.
Absolutely. I love that. So next, we're going to bring on, in our next episode, we'll bring on Pilar, and you and Pilar will have a conversation, and you'll be able to share more of the real time of what's really happening. So looking forward to it.
Yeah, that's going to be great. Just to get the senior living operator's perspective on her challenges. And as much as I've spent all this time learning and asking questions, I probably have barely scratched the surface of what there is to learn. So that'll be an exciting conversation.
Definitely.